There's many different ways to do hip replacement. All of the ways that are out there currently, they all work. The question is what are the pros and cons, right? So posterior approach, it works. It's the approach that I sometimes have to use if there's hardware from a previous surgery, or if I need to do a very large, extensive surgery, maybe for someone who's had a very large fracture or so forth. But there's risks. There's a much higher risk of dislocation. You're cutting muscle. You have to have precautions post-operatively. Anterior approach allows us to not have precautions. It allows no muscle cut. And in the first 3 weeks, particularly, there's a much quicker return of function. You're getting off the walker faster, off the cane faster, much less narcotic use, much less need for therapy. 92% of my patients don't need any therapy with this approach. The Hana Table itself allows me to position the hip to get those parts in correctly. That's one of the negatives to the anterior approach, is that you have to make sure the parts are going in correctly. So if you're brand new at this, you definitely want to spend time with a surgeon like myself or other surgeons who've done this for a number of years to learn how to do it. Very much like residency is learning how to do the procedure through these older approaches. The Hana Table allows me to reproducibly get that exposure without cutting muscle, allows me to get the parts in, allows me to use an x-ray to verify that the alignment is as good as we can make it, rather than the way that, so without a table, the surgeon's still guessing. Is the leg length right? I think so. It feels good. Yeah, admittedly I've done thousands of these, so I can do that too with this approach, but the table allows the access of the x-ray to actually measure. And so before the patient ever leaves the room, which is the best chance at a great outcome, I know the parts are where I want them.